रोहनने नंदिता मॅडमना ब्लर केलं मागून.
हो सर, थोडंफार.
रोहन इज ट्रॅव्हलिंग.
नाही, आम्ही आता रिसेप्शन व्हेन्यूला पोहोचतोय, तर त्याच्यामुळे गाडीत आहे.
परवा मी कोल्हापुरात होतो तेव्हा पाहिलं, सयाजीच्या बाजूलाच होतो. तयारी
ओके.
चालू होती, जोरात
हो
तयारी,
हो,
कळलं होतं मला.
उद्या
मदन सर,
परत
हॅलो.
आम्ही निघतो.
सॉरी फॉर द
येस येस
डिस्टर्बन्स
प्लीज.
सर. आता आपण युट्यूबवर लाईव्ह आहोत, राईट?
ओके.
येस येस. जस्ट लेट मी शेअर माय स्क्रीन. Sir, is the screen visible?
Yes, yes, please.
Perfect. Just a second. Okay, so good evening, respected faculties and delegates present over here. On the behalf of Corona Remedies Limited, I, Harshvardhan Nalawade, welcome you all for the Core Connect live webinar in association with the Association of Maharashtra Obs and Gynae Societies, as well as MP Gynae Society. So, for today's session, we have our conveners, Dr. Madan Kamble sir, as well as Dr. Prerna Keshan ma'am. So, talking about Dr. Madan sir is National Coordinator of Foxy Sexual Committee and STI Committee. He was in chairperson of Sexual Medicine Committee and is also Zonal Coordinator of AMOG. Currently, he is President of Obs and Gynae Society in Akluj. Talking about Prerna ma'am is a consultant ob-gynae infertility specialist.
That will be enough. You can move on.
Sure, ma'am. Now just let me play a video. Madan sir, may I?
Yes. Requesting all dignitaries to join the e-lamp lightning.
Okay, perfect. So with this, now I hand over the session to Madan sir and Prerna ma'am. Madan sir, please continue.
Yes, thank you so much. Good evening, everyone. Myself, Dr. Madan Kamble. I'm very happy to welcome you all for this special webinar. I would like to say this is the first webinar of this new tenure of AMOG's new executive committee. I'm the zonal coordinator, zone 4 of AMOGs, and under the able leadership of our dear one, respected Dr. Amey Purandare sir, who is the newly installed president of AMOGs, and Dr. Rohan Palsetkar, honorary secretary of AMOGs. First, I would like to congratulate both for taking over this wonderful organization and the entire team of AMOGs. I'm very proud of being AMOGsian, and I'm continuing my mission of this CMEs and all the educational activities with all these societies, Foxy societies and AMOG societies. On this platform, I wholeheartedly welcome today's chief guest, none other than Dr. Sunita Tandurwalkar ma'am, and our very own Dr. Amey sir as chief guest, and the esteemed guest of honors, Dr. Kavita Bapat ma'am,
Yes.
Dr. Archana Basir ma'am, Dr. Asha Bakshi ma'am, and Professor Dr. Kavita Singh ma'am as guest of honors. Also, I welcome today's all the faculties, Dr. Dipti Gupta, Dr. Monica Singh ma'am, and all the chairpersons, and all the esteemed panelists from all the Madhya Pradesh societies. We are so honored to have association with all the Madhya Pradesh societies for this academic platform. And AMOGS is also thankful to all the MP societies for having this collaboration. May I have the CV slide of Sunita ma'am, Harshvardhan?
Madan, please, no
Yes, ma'am.
slide, no introduction, yeah.
Okay, ma'am.
We all are friends
yes,
and we
yes,
know
sir.
each other so well.
Yeah,
So-
we welcome you, ma'am. Over to you, ma'am.
Yeah, thank you so much. And Ameya, official congratulations to you and Rohan, my favorite people, taking over the Maharashtra ISAR, not sorry, ISAR, Maharashtra and AMOGs is a fantastic things. And I'm sure the Maharashtra, as usual, will be shining under the leadership of yours. अमेय तू चाणक्य म्हणते मी तुला तुला माहित नाहीये. So definitely. And Madan, thank you so much. Fantastic photo. I was tired of putting my red photo everywhere. But anyway, meeting the Foxy team, AMOG's team, always feel pleasure coming back home from ISA. And most importantly, the adolescent topic. Probably, I think, Amey, this is your first webinar to my knowledge, unless all the coordinators and zonal chairpersons are rocking like Madan. But most importantly is the topic which you selected. I think teenage pregnancy is so important. In our Foxy presidential year last year, we have come out with the teenage statement, which was circulated to all of you. And I think if we increase the awareness and we spread out on adolescent health, three things I definitely feel apart from obesity. One most important is cervical cancer information about the vaccination. And second thing is avoiding the teenage pregnancy. Two different class of people, but very important. And I think, Madan, you have chosen a very right Prerna. You are a fantastic girl, Reja. I have never worked with you before. And last year, I noticed you are amazing. You are not only hardworking and intelligent, you have a presence of mind, which you showed me in Delhi AICOG. Fantastic. Keep on doing a great work. And Rohan, you are climbing with Ameya everywhere from Mox to Foxy, and you will be climbing with us in ISAR also. So all the best to both of you. Enjoy. Only role changes, the same people, the same frequency, same thought process. Definitely it will work. Thank you.
Thank you, ma'am. Ma'am, you did not let us introduce you.
I don't need, yeah.
Formally,
No.
but ma'am, something from the core of our heart we need to say, which
Yeah.
we cannot help saying, is that you are somebody who is that meticulous and far-sighted. And when it comes to any matter of OBGYN fraternity, you have that global perspective in your mind. And then you are a leader par excellence, whom we look as a pathfinder in generations to come. Thank you, ma'am.
Thank you, dear. Thank you for
Thank-
your kind words. Thank you.
Thank you, ma'am. Thank you. Yeah. I welcome our chief guest, Dr. Amey Purandare, sir, the president of AMOGs. And I congratulate sir for his recently we held AMOG's annual conference at Mumbai. It was a wonderful conference and wonderful installation. I welcome you, sir, and over to you, sir, for your blessings.
Yeah. Thank you, Madan. Congratulations on being the opening batsman for the team AMOX. I know that the opening batsman is the most important in the team, and therefore my best wishes to you. I'm sure that you will have a great innings in whatever post you want to hold. You have, like I told you, you have been a valuable asset to AMOX. AMOX has groomed you, and I am extremely proud of your sincere efforts in the last so many years that you have worked with AMOX. To Prerna, also I congratulate you for integrating with AMOX and also working with AMOX. Well, I always believe that Sunita ma'am's positivity is the biggest asset that I learned in her Foxy tenure. So even though she could not come for the installation, but her blessings, her good wishes, and just her smile and support, I could manifest them when I was taking over. So, madam, thank you for always being there, believing in me, and encouraging me. Well, the three Bs are my favorites. Maharashtra and Madhya Pradesh are neighbors. So, Dr. Bakshi, Dr. Baser, and Dr. Papad, thank you for being here and joining hands with AMOGs on such a very important topic of teenage pregnancy. Teenage pregnancy is a challenge because not only are you dealing with a pregnancy, but you're dealing with a pregnant lady whose body, mind, and the society is not ready for it. So, therefore, Madan, very important that you took this topic. Uh, Dr. Monica, uh, Dr. Monica, my good friend, is also here, and I'm happy that you have also joined the AMOG's webinar. And through your insightful knowledge, AMOG's members will greatly benefit. Dr. Brajbala Tibari is also here, and thank you, ma'am, for being here in this webinar. As also, I can see Dr. Rekha Singhal, Dr. Kavita Singh, Dr. Deepti Gupta, uh, as some of the other faculty members who are here this evening. Uh, at AMOGS, we have strongly said that we want to collaborate and integrate because alone in Maharashtra, we will limit our purpose and passion to the state. But if we want to make an impact for the country, AMOGS has to integrate with the sister societies all around India to magnify and amplify the efforts. I'm very thankful and very happy to see my secretary, Dr. Rohan Palshetkar. Dr. Rohan is working 24 by 7. I'm very happy with his efforts and many of his innovative ideas to streamline and to smoothen, and more importantly, to ensure that AMOX reaches the lengths and breadths of not only the state of Maharashtra, but the country. So, Rohan, keep up the good work. I'm sure that this is just the beginning, and you will rise to further, and you will gain this AMOX experience to utilize it at higher posts. So once again, I welcome all of you. I'm extremely happy and pleased with the topic of this CME and the extraordinary and eminent faculty that you have accumulated and whom we will learn a lot about. Thank you once again. And Madan, wish you all the best. Prerna, wish you all the best in all your
Thank you.
endeavors. Thank you.
Thank you, sir. Sir, it would be an injustice if I say that nothing about the last AMOG's Mumbai, and what an installation and what a splendid show it was. Sir, Maratha AMOG's as well as Rohan were always very close to our hearts. But this time the language Marathi even and had a legendary feeling that will be remembered for ages. And it was instilled into our hearts forever. Thank you so much, sir, for such a splendid show at Mumbai.
Thank you, Prerna.
Thank you so much, sir. And one more thing I would like to appreciate our theme by you, the Mission Me and Missions 3. We appreciate this and support this mission very proudly. Thank you, sir.
Thank you so much, Madan.
Yes, sir.
Then
Yes,
have a
over to
few
you,
words
Prerna.
from Rohan.
Yes.
What to say about my Young Talent Promotion Committee Chair and AMOG Secretary, Dr. Rohan Palshetkar. Such inclusiveness for a girl who is in the farthest of the eastern India, the northeast India. He has shown such inclusiveness and that confidence that he has given onto myself that Prerna, go ahead. So that is something which I always owe you, indebted always, Rohan, for such being such a apt leader and such a great guide, I would say. Thank you so much forever, and we'd like to hear from you as a secretary, AMOGS.
Thank you so much, Prerna, for such a beautiful introduction. Apologies, apologies. I'm at my brother's wedding, so there's a little bit of chaos here. But I have to say that I love the fact that you and Madan sir have collaborated with the Madhya Pradesh Obs and Gynae Society, because I think the entire way to go ahead is always by collaboration. We all need to work together in order to ensure that we progress together. And as Sunita ma'am has always said, that we want to create followers, we want to create leaders, not followers. So, and I think that's something that's been there. Asha ma'am, Archana ma'am, Brijbala ma'am, Kavita ma'am, they have always been such great teachers. They've always the best part about them is that you just pick up the phone, they'll answer it, they'll be there for you always. So, madam, thank you so much for being a part and collaborating with the AMOGs. How can I not say anything about Amay sir? He's a teacher, mentor, guide. I'm so glad that I'm his secretary because it gives me even further learning steps, which I've been learning from him since 2019 when he was the joint secretary for my mother. And I have got to learn so much from him that I'm glad I'm being able to do as much as I can to ensure that we are able to take Amogs under his leadership to newer heights. So I just want to wish you, Madan sir, I think Monica ma'am, and if anybody I'm missing, I'm really sorry. All the best for your future endeavors, which are coming up soon, I know. So all the best for that. And I'm really looking forward to the scientific program because it's a very interesting topic you'll have taken as well. So all the best. And Prerna, I love the work you're doing even for the Foxy Young Talent Promotion Committee. Please keep it up.
Thank you. Thank you, Rohan.
Madan,
Yes, sir.
Madan, I just want to say one more important thing is that Dr. Archana Baser, you are very much a part of AMOGS. Your roots are in Mumbai, and we can never forget you and wish you all the best. We are all with you in your journey. So,
Thank you, Amit. It means a lot to me.
Yes,
So
best wishes, ma'am. Best
let
wishes.
us
Thank you.
add on to this that Rohan is the youngest secretary AMOGS could have ever had, and uh,
What about
Let
the
me add
president?
on
Is the
one more thing. Amay sir is
president
the
also
youngest
youngest?
president also.
Yes.
Oh, great. Apart from this, the innovations, as Dr. Ame have already said, the innovations Rohan put up are beyond compare, and we wish you, Rohan, a great tenure ahead. So with us, our guest of honor, we have a first guest of honor, Dr. Kavita Bapat, Madam. Dr. Kavita Bapat, Madam, needs no introduction. She's the past VP of Foxy. But if I, from my whole heart, want to introduce Ma'am, Ma'am is the first, one of the very first Foxians who believed in me and said that, Prerna, if you are here in Foxy, you are here to go ahead. So that is something, Ma'am, we are so very loved and revered. So very, Ma'am, from the core of the heart, we are saying that we all love you so much. Ma'am, the dais is all yours.
थँक यू सो मच डार्लिंग थँक्यू सो मच सगळ्यात पहिले खूप खूप शुभेच्छा आणि खूप सारी बधाई अमेय भाई आपको आज आप अमॉक्स के प्रेसिडेंट हो कल आप फॉक्सी के और परसों आप फिगो के हम सब आंखों से देखेंगे इफ आई एम नॉट रॉन्ग एवरीबडी विल एग्री विथ मी सो खूप 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 शुभेच्छा अमेय तुम्हाला आणि रोहन आपको भी बहुत बहुत बधाई एंड मदन एंड प्रेरणा डू वेल we are with you. All the best. All the Madhya Pradesh societies will definitely support you. Support our Archana Baser also. And Monica, we are with you. Thank you so much for inviting me, given me the chance. And I'm extremely sorry that I'm not, video is not, I'm not, मतलब उसको खोल नहीं रही हूँ. So thank you so much. Prerna, love you. And all the best. Prerna, Madan, Monica, all. Thank you so much. And
Thank you,
good
ma'am.
topic you have chosen for today. Thank you so much.
Thank you so much.
Thank you, Kavita ma'am, for your words of wisdom. And we now have our second guest of honor, Dr. Archana Baser, madam. So right now we are very much enthusiastic about campaigning for madam. And madam, we wish you all success in your tenure. We do not want to introduce you with such this thing comes what we are feeling right now for you. And ma'am is the past VP of Foxy, and Indore is capturing the entire flyer you can see. So such heavy base Indore has in Foxy, ma'am, it cannot be denied. So ma'am, the dais is all yours for your words of wisdom, ma'am.
Thank you. At the outset, let me thank the conveners of this program, Dr. Madan Kamble and Dr. Prerna Keshan, for really collaborating MPOGs and all MP societies. I think as all the leaders before me have all expressed that collaboration and integration is the way forward for progress of all of us together and for the well-being of the women in this country. So it is very, very important. So I'm really happy to share the dais with past President Foxy, the President of AMOGS, Secretary AMOGS, Dr. Amay Purandare. He's always been such a wonderful person, always approachable. Rohan, what I can say about Rohan, very humble and very person who will always talk to you with great, as a gratitude and all. And Madan and Prerna, you have a great, way to go ahead, and you all are doing so much of efforts. And the topic you have chosen today, the teenage pregnancy, I think it is a very important topic, and especially it fits in very well in the today's world when we are having, it's like a storm when there are like lots of social media, internets and everything. So I think it is very important that we ourselves first learn about it, what are the pros and cons and how really to handle it, and then we can really guide the young parents how to take care of their teenagers. So it's very important topic, and I wish you all the best. And I'm really happy that all Maharashtra societies and all MP societies, I could see our current president of all MP, Dr. Kavita Singh, Dr. Dipti, secretary, my 3B part, Dr. Kavita Bapat, Dr. Asha Bakshi, and all the MP societies here who have joined hands with AMOGs. So I assure you that all Maharashtra will get full support from all MP, because the two states, kind of two states, and we are two states very close by, and we will work together. And all the best to Madan, and all the best to Prerna, all the best to Monica, and all the best to myself as well. So thank you very much. Looking forward for a great academic evening ahead.
Thank you, madam. It is always a pleasure to hear you speak. Over to you, Dr. Madan.
Yes. Thank you, Archana ma'am, for the kind words, and wish you all the best again.
Thank
Yeah.
you.
I welcome our next guest of honors, Dr. Asha Bakshi ma'am. Can I have CV, ma'am? Ma'am is senior Foxian, past vice president of Foxy, and also second vice president of ISAR, founder chairperson of MP IAG and MP ISAR.
I think that's enough.
Ma'am is so
Madan.
kind and lovely person. We are so lucky to have ma'am, you as a guest of honor. I welcome you, and over to you, ma'am, for your blessings.
Thank you so much, Dr. Madan and Dr. Prerna, for coordinating this program and inviting us. And I've seen your hard work during the last year also when you were there in the sexual committee with Dr. Neeraj. So you have been working all through. And so I've seen Prerna also on various platforms working very hard. So it's really nice, and all the best to both of you. And so nice to see the vibrant team of Dr. Amay Purandare and Dr. Rohan Palshetkar. Amay, we all know, is a very hardworking person. We all saw him how he worked as a secretary with Dr. Nandita Palshetkar. He's very intelligent, very friendly, and very witty. I always, whenever I meet him, I feel he's one of us own. So that's how Amay is. So nice to see you as a president AMOGS, a very prestigious society. And Rohan, we all have seen, I've seen him, young Rohan, as attending ASHRAE, and now how well he is groomed. And I've seen his determination, how determined he is and how knowledgeable he is. This is how one should be, very hardworking. So, and all the best to both of you for your tenure in AMOGS. And so nice to see Dr. Sunita Tandulwarkar at this platform. And I wish her all the best for her next role, and that is her role as grandmother. And at the same time, I'm so pleased to see all my Madhya Pradesh friends, Jyoti, Kavita, Jyoti, Archana. My best wishes to Archana and Monica for their endeavor, and I'm sure they are going to do very well. And Archana, you are really working hard, and that is very well seen all over India. And nice to see the topics today, the topics of teenage pregnancy and impact on social media. And I hope Monica covers not only just impact of social media on teenagers with the routine things, but aspect which really needs to be very much pinned in, very much focused, and that is fertility awareness amongst the youngsters. Because there is a survey where 90% of the youngsters, they want to have live-in relationship, and 80% do not want to have pregnancy. So that is one thing which we have to make them aware about fertility, what it is, and they take it very easy. But what is the future? So all those things really need to be focused. So I'm sure this webinar is going to be very good, and all the best for the webinar and for the AMOGs. So nice to see you all.
Thank you so much, Asha ma'am, for taking out time from your busy schedule. I still remember your strong support as Vice President in Sexual Health Committee of Foxy during near research time. You are always supporting. Thank you so much for having you here. And our next guest of honor, Dr. Professor Kavita Singh ma'am, is the President of AMPOGS. She is a professor and dean at GMC Bhopal, and also ex-professor and HOD at Jabalpur. I think, has ma'am joined? I couldn't see ma'am. Yeah. We welcome Dr. Kavita ma'am. Whenever she joins, we will take her blessings. I welcome also Dr. Deepti Gupta, who is the Honorary Secretary of AMPOGS. I also welcome all the Foxy chairpersons from MP, Dr. Jyoti Banglwala ma'am, Brajpala Tiwari ma'am, and Dr. Sweta couldn't join, and all the stalwarts in MP. Maximum belongs to Indore, the vibrant society. I wish Dr. Monica Singh ma'am also and Archana ma'am best wishes for upcoming elections.
Thank you, Madan. Thank you so much.
Yes, I once again thank from the bottom of my heart all the chief guests and guest of honors for having here, and blessings for the AMOGs and collaborating with the AMOGs with MP societies, and looking forward to a wonderful session ahead. Thank you so much. Thank you. Now we will move on to scientific session. Prerna, can you take over?
Yes, yes.
Just a second, sir. I'll stop my screen share.
We once again welcome you all to this very esteemed CME with AMOGs and the. Is it the screen is shared? That's fine. Yeah. Our first speaker is logged in, Dr. Dipti.
Yes, Dr. Prerna, I'm here. Unfortunately, my video isn't working today.
Oh, is it? Okay.
Yeah.
So if you mute once, then also will not be able to see you?
No, I tried everything. I tried logging out. I checked the camera settings, but it seems there is some problem. But the screen share is working fine. So I think the session can carry on.
Okay, fine. So we have a first session on teenage pregnancy. And that is, as Dr. Sunita Madam has already said, it's such a very relevant topic in today's date. And for this, we have none other than our Secretary of all Madhya Pradesh OBGYN Society, Honorary Secretary of from the Jabalpur Society, Dr. Deepti Gupta. And to chair this session, we have Dr. Neeta Parashar Madam, President Jabalpur Society, Dr. Sunita Chauhan Madam, Secretary Indore Society, and Dr. Abha Jain Madam from President Bhopal Society. I welcome all the chairpersons and a speaker. I request Dr. Neeta Madam to kindly introduce Dr. Deepti. Can we have Dr. Deepti's CV?
I think if the conveners
Yes, sir,
deem it appropriate, I think we should just start with the session and use the time for discussion.
Yes.
So,
if the chairperson have any opening remarks, Dr. Neeta Madam, Dr. Sunita, Dr. Abha, if you're there. Neeta Madam is there. Neeta Madam, please unmute. Madam is logged in, but Madam is not unmute.
Okay.
Yeah, so you can start. We can have their closing remarks.
The
all
yes,
right. So I request Mr. Harshvardhan to please allow me to share screen.
Yeah, just a second, ma'am.
Anita, madam, please unmute yourself if you want to give any opening remark for Dr. Deepti. She'll be speaking on teenage pregnancy, Nita, ma'am.
Okay, ma'am. Now I've stopped the screen share. You can share the screen now.
Right. Is my screen visible?
Yes,
Ma'am, yes, ma'am.
it's visible.
All right. I have put it on slideshow as well. So at the outset, I'm truly humbled and honored to be sharing this dais with stalwarts and our esteemed chief guests. My greetings and regards to respected Sunita Tandulwadkar, madam, respected Amay sir, dear Rohan. It's a record of a sort to have the youngest president and secretary leading one of the strongest state bodies in the country. And my greetings and regards to the not just the three big Bs, but the other two Bs who have joined them as well. Kavita Bapat ma'am, Baser ma'am, Bakshi ma'am, Banglowala ma'am, and Brijbala ma'am. Of course, my mentor and guide, Kavita Singh ma'am. All my dear friends from MP who have joined in as speaker, chairpersons, and panelists. And of course, I'm extremely grateful to the conveners, Madan sir and Prerna, Dr. Prerna, for this opportunity. So the first topic for today is teenage pregnancy. And greetings from the beautiful city of Marble Rocks, Jabalpur. My humble greetings and regards to all esteemed dignitaries present here, and thank you for the opportunity. So, teenage pregnancy, as we all know, is a very important public health problem, though definitely it is not so often discussed. And it is very thoughtful of you, Madan sir and Dr. Prerna, to think of this topic and to have a structured discussion which are going to directly and indirectly affect outcomes of teenage pregnancy. It not only impacts maternal health, but it has long-lasting effect on neonatal and social well-being as well. And it is one of those situations which requires preventive and multidisciplinary strategies. So when we talk about adolescent or teenage pregnancy, apart from the biological and reproductive aspects, I would try my level best to touch upon the social, psychological, and legal aspects as well. Trying to define a teenage pregnancy or adolescent pregnancy, World Health Organization defines adolescent pregnancy as one where pregnancy has occurred in a young woman aged 10 to 19 years. As far as the global numbers are concerned, global adolescent birth rate has decreased by 23.2 births per thousand women over the last 2 decades. This may sound like a good decline, but low and middle income countries still have around 21 million adolescent pregnancies annually. Talking about Indian figures, in NFHS 3 survey 2005 to 2006, approximately 16% were reported to have teenage pregnancies. This number showed a good decline to 7.9% by the time of NFHS 4. However, since then, the fall has not been very good. As per NFHS 5, the last survey, it shows that 6.8% of women in the age group of 15 to 19 are either pregnant or have already born a child. Now, to many, this may seem like a small number, only 7%. But when we convert it to actual figures, taking into account the number of adolescent girls in that age group in that survey, it comes to approximately 8 million. And as per the same survey, over 53% of currently married females aged 15 to 19 have already begun childbearing. So this is the same data shown diagrammatically, and definitely as logic would tell us, the rural prevalence is more than the urban prevalence, and it is driven by certain social factors like early marriage, poverty, limited education, etc. And there are certain states marked in red and deep orange, which have higher numbers of teenage pregnancy to the tune of 14 to 16%. In fact, it went on to convey that education was one of the key determinants, wherein no education in the group of no education, 18% of teenage pregnancy was reported, compared to only 4% when there was presence of more than 12 years of schooling. So outcomes of teenage pregnancy are clearly influenced as everybody has been mentioning, by biological immaturity, unintended pregnancy, inadequate perinatal care, poor maternal nutrition, and stress. And unfortunately, this sets in a vicious cycle which needs to be broken. Apart from that, the situation is further plagued by numerous hurdles in diagnosis and care. So often, girls are not even aware that missed periods or amenorrhea could mean pregnancy. Then there is the fear of being judged, biased, and the fear of getting ill treatment. Not just the girl, but the family also deals with the fear of being ridiculed and not accepted. Then there is the fear of being reported under POXO. Add to it lack of knowledge about safe MTP services and pregnancy care. There is a paper which reports that MTP percentage in teenage pregnancies is 9.15% compared to 5% in general population. And out of all unsafe abortions taking place, at least 14% are being attributed to teenage pregnancies, which is a huge baffling number. Now, these maternal and fetal complications are very well known to all of us. This is just a recap. Maternal complications would obviously include unsafe abortions, anemia, and various other nutritional deficiencies, leading to pregnancy-induced hypertension, eclampsia in worst-case scenario, puerperal endometritis, and various other perinatal problems. The neonatal problems often include prematurity, preterm rupture of pre-labor rupture of membranes, low birth weight, congenital anomalies, and higher risk of stillbirth or neonatal death. These nitty-gritties, I don't think this is the right forum, or perhaps we don't really need to discuss the medical aspect or management. All of us are very well versed with the medical management of all these clinical situations. Also, one of the papers pointed out that pregnancy-related conditions rank among the leading 5 causes of disability-adjusted life years and mortality in the adolescent girl population. Further on, we have to deal with the delivery challenges. The body structure is immature, the pelvis is inadequate often, and not only they have a higher likelihood of landing up in obstructed labor, but also higher likelihood of operative delivery. Clearly, they require skilled birth attendant where labor abnormalities can be diagnosed timely and referred appropriately. In fact, in my personal opinion, these girls should be delivered at a tertiary institute or an institute which has, multidisciplinary team to handle not just the medical, but the neonatal and psychological aspects as well. So institutional delivery is definitely very, very important and in these patients. And I think quite the contrary, because of all the social stigma and fear, they probably avoid reaching appropriate facilities and specialists. So just to sum up the obstetric aspect of it, we need to adopt a non-judgmental approach with not just the medical care, but the counseling of care providers as well. There has to be nutrition optimization right from the beginning. We need to actively consider prediction and prevention of preeclampsia in these patients. They require good antenatal fetal surveillance because they are at risk for various maternal and fetal complications. And ideally, they should be delivered at an institute experienced in handling high-risk pregnancy with difficult labor. Apart from the medical aspects, the psychosocial consequences need to be kept in mind. These patients are more likely to be cognitively and emotionally immature. And it has been reported that they experience perinatal mental health issues at rates up to 30% higher compared to their non-pregnant peers and adults. They face the risk of, abandonment, unfulfilled ambitions. They may be struggling with prior psychological health issues or traumatic events. Of course, because of the teenage status, they have a lower educational level and they are dealing with economic hardships as well. All of this further contributes to school dropout, domestic violence and stigma, and repeat teenage pregnancy. So these are the various long-term consequences. There could be perpetuation of this social cycle. They could land up with various forms of and severities of emotional trauma leading to fragile families, depression, stress, low self-esteem, and of course the potential risk of HPV infection eventually leading to cervical cancer. In fact, in this belt, we still see a lot of advanced stage cervical cancer presenting in late 30s to early 40s. So in my presentation, I have intentionally put risk factors towards the middle and end of this talk, because this I wanted to touch upon in a little more detail. Risk factors, as we already know, some of them, the more obvious ones, include early marriage and poverty, lack of sexuality education, poor contraceptive awareness, and sexual coercion and peer influence. In fact, we have upcoming talks on impact of social media on adolescent health by Monica ma'am, and I'm sure a very engaging panel discussion on psychosexual issues in adolescents. So there we would be getting more insights on these topics. Now, a few other determinants, cultural determinants, like early marriages and age-based hypergamy. Even though almost 2 decades back, the Prohibition of Child Marriage Act raised the minimum age of marriage to 18 years for females, yet this data is a little old, but then at least 40% of all marriages were between adolescents under 18. Hypergamy, that is the age gap marriages. It is believed that traditionally it is always believed that husbands should be older. And this Udaya survey, which was done by Population Council, understanding the lives of adolescents and young adults, which surveyed for approximately 5,000 girls, it has actually reported that the spousal gap of 5 to 10 years was associated with a 52% more likelihood of the girl getting pregnant. Then the next subgroup of concern is the marginalized communities. We know that in our society, even now, the caste and religious system is quite deeply intertwined. So that is another aspect that we need to keep in mind. And then, of course, past history of sexual violence and sex work is also has been shown to be positively associated with adolescent pregnancy. Talking about a few of the socio-economic determinants, in the socio-economic determinants, first and foremost, the most important one seems to be the sexual and reproductive health education, which, even though made kind of compulsory, recommended, yet is not being imparted as effectively as it should be. As of now, we know that so-called safe sex information for most of the adolescents is still like, friends, media, which we know how reliable or unreliable is. So SRH knowledge has clearly been linked to the number of years of education also, which, brings us back to the square one. Then socioeconomic status is next social determinant, which has been linked with adolescent pregnancy. Lower strata have reported higher prevalence, higher numbers of teenage pregnancy. And then, of course, the rural versus urban. As the statistics show that the numbers are higher in rural areas, because they still seem to have this pro-natalist mindset, that more hands equates with more working hands, equates with more income, so to say. But that we know is not the case. It's not that the government has not done anything. There have been several initiatives. The Reproductive Maternal Neonatal Child and Adolescent Health, or the RMNCH plus A program. So earlier, the Adolescent Sexual and Reproductive Health Strategy used to be a separate program between 2005 to 2014. Then it was integrated and amalgamated with the RMNCH plus A in 2014. And they have initiated several activities, about counseling centers, availability of contraceptives, nutrition support, etc., etc. But there still seem to be some gaps in the implementation of the program. The most tricky dilemma that most of us clinicians face, crossroads with POXO Act. We know that sexual activity less than 18 years is a statutory offense, and we by law are mandated to report any sexual activity under 18 that comes to our knowledge. So here comes the ethical dilemma of confidentiality versus legal duty. And this is one area where we require very sensitive counseling. And in fact, if time permits, I would request the experts to shed some light on this and how to deal with this situation. So to kind of summarize, there are various categories of needs and where we have these gap areas for the pregnant adolescents needs. Sexual and reproductive health rights, the contraceptive education needs to be stepped up, protection from sexual and gender-based violence or abuse, healthy sexual relationship education, encouragement to disclose harmful experiences, and development of available sexual and reproductive health services needs to be encouraged. As far as high quality, accessible healthcare possibilities are concerned, we need to ensure available methods of contraception, discuss reproductive health with the primary care physician, preconception preventive care strategies, advanced mental health services, accessible healthcare, particularly in rural and low income areas. Perhaps we should consider available healthcare insurance for pregnant adolescents, comprehensive perinatal healthcare guidance, and access to safe and legal abortion, which legally is there, but most patients are not aware that the system is in place. Support in areas of stigma, reduce the stigma in society, advocacy for positive adolescent sexual health and parenting representations, support in areas of children's rights, prevention of child marriages, again, though the act is in place, but the implementation is still not 100%, restriction of cultural traditions violating children's rights, adolescents' autonomy protection. Talking about education and economic support, financial support, available education possibilities during or after pregnancy, and employment opportunities. And of course, last but not the least, support from family and community, connection with baby's father, reliable communication between adolescents and their parents, guidance on maternity from family teachers, social workers, emotional and compassionate connection with healthcare workers, development of coping strategies for young girls, and solidarity from pregnant or parenting peers. So in a nutshell, this I felt kind of sums up where, adolescent girl, which may be struggling with school discontinuation, psychosocial stress, nutritional vulnerability, lands up in early motherhood, faces obstetric risks, economic dependence, identity transition, along with infant outcomes of low birth weight, malnutrition, etc. Now, this infant further grows up and in childhood and adolescence struggles with poor education opportunities, health inequities, social disadvantage. And then that is how the vicious cycle perpetrates and goes on forever. In fact, the 2011 WHO guideline was recently updated and published in April 2025. And I think all of us should have a look at this. WHO guideline on preventing early pregnancy and poor reproductive outcomes among adolescents in low and middle income countries. And it has given a few key recommendations. Low certainty evidence ones are to empower girls, reduce child marriage, and to have laws for age of marriage, which we already do. And moderate certainty evidence conditional incentives to increase educational attainment, remove gender barriers to education, again, economic empowerment of girls, behavior change intervention for contraceptive use. So teenage pregnancy, this can be a proposed integrated prevention framework where we combine clinical care, family and community, public health, social interventions, and policy and legal matters, ultimately all aimed to target a reduction in teenage pregnancy, rather complete elimination of teenage pregnancy. Towards the end, I would just like to say that no one has ever won a game of chess by only taking forward moves. Sometimes we have to move backwards to take better steps forward. I think that's the case with teenage pregnancy. So here, instead of just looking at the obstetric care and optimizing obstetric outcomes, we need to step back and give due attention to her psychosocial background, past trauma, contraceptive awareness, etc. And then trace it back also to the socioeconomic status, education, financial independence, rope in appropriate local authorities, pediatricians, counselors, and see what best can be done. So unfortunately, all of our girls do not have a happy outcome like Preeti Zinta did in this movie, Kya Kehna. And I hope all of us can work together to deliver good outcomes to our patients. Thank you so much for patient listening.
Can we have others muted, please? Can we have? So that was quite an elaborate, exhaustive, and informative talk on teenage pregnancy. You have touched every core of it. We would like to hear from our chairpersons, Dr. Neeta Parashar, Madam, Dr. Sunita Chauhan, Madam, and Dr. Abha Jain, Madam. Your inputs on this, Dr.
Yeah.
Sunita? Yes,
So
ma'am.
yes, good evening,
excellent
Dr.
lecture.
Prerna. Okay, please carry on.
Hello.
Ma'am,
Excellent.
just a second. Sorry, I forgot to mention that best wishes to Baser ma'am, Monica ma'am, Madan sir, and Prerna ma'am, and full support wherever possible. Thank you so much.
Excellent lecture, Dr. Dipti. You have covered each and everything of teenage pregnancy, from social dilemmas to management and how to take care of the teenage pregnancy and how it should be avoided. Thank you very much for excellent talk.
Neeta, Madam. Neeta Parashar, Madam.
Good evening, everyone. First of all, thank you very much, Dr. Madan sir and Dr. Prerna, for making me part of this webinar. And Dr. Deepti, I could not introduce you. I'm really sorry. My phone had some glitch that time. And I would like to share one thing about Deepti. She is very talented multitasker, and she is a very good painter also. She's from our city, Jabalpur. And Deepti, you actually, it was really very interesting presentation by you, and you have covered all the topic on teenage pregnancy, impact, global impact, and incidents, and then risk to mother and baby, as well as keys to management. Like we have to actually give comprehensive sex education, as well as we have to give access to contraceptives to these teenage girls, as well as we should also counsel them regarding, once they come to us with this pregnancy, we have to counsel them regarding pregnancy options, like they can go for adoption, abortions, and if they have this baby, then how to do a good parenting. So we should also advise them about this. Thank you very much.
Thank you, ma'am. Can we hear from Dr. Abha Jain, Madam, if she's here? Dr. Neeta, Madam, we can't see you, but your video is off. Is that off by some technical problem or?
Yeah, it's not actually. Actually,
Okay, we
it's
would have
not
loved to
showing.
see
Yeah,
you.
yeah.
We would have
Okay.
loved to see you. Do we have
Yeah.
Abha Jain, Madam, with us? So if not, we can move on to a thank all our chairperson and our speaker, Dr. Deepti, have done a fair job with the subject. And it was quite an enlightening session. We now move on to a scientific session 2.
Hello,
Yes.
can I
Rajna.
ask something?
Yes,
Yes,
please.
Rekha ma'am. बोलिए.
As you, Dr. Deepti, as you said by the definition, the teenage pregnancy is by age is 10 to 19 years.
Yes,
But by
ma'am.
the Indian law is also up to the age of 18 years.
Yes, ma'am. Ma'am, that is what is happening. Ki law has prohibited any sexual activity and marriage before the age of 18. But we
Yeah,
are still seeing many patients in our practice. In fact, 16, 17, a lot of them are married, consensual sex, and coming with
yeah,
pregnancies. So that
yeah,
is where this dilemma comes into place. By the law of the land, we are bound to inform the authorities. Then whether to take any action or not is up to the legal authorities. But if any pregnancy, if any sexual activity has taken place, for example, 18 के बाद patient 7 months of pregnancy के साथ आई है, but her
yeah.
last menstrual period was before the age of turning
Before
18,
18.
then
Yeah,
by law we are bound to report.
yes. Okay.
Thank you so much, Dr. Dipti. Fantastic presentation.
Thank you, sir. Thank you for the opportunity once again. Best wishes.
Yes, thank you. Let us move on to second talk. Harshvardhan, can I have CBO chairpersons?
Yes, sir.
Yes. For the second talk, we have got fantastic speaker, Dr. Monica Singh ma'am from Bhopal, and the chairpersons, Dr. Neelam Tejwani ma'am, who is the president of Ujjain Society, Dr. Ruchi Saxena ma'am, who is the president of Narmadapuram Society, and Dr. Rita Mishra ma'am, who is the president of Gwalior Society. I welcome all the chairpersons and request the chairpersons to introduce our speaker, Dr. Monica ma'am. Yes, is there anyone joined? Dr. Neelam ma'am, Ruchi ma'am, Rita ma'am. Rita ma'am was there. Okay. Mm.
It's okay, Dr. Madan. We can start the lecture. I think chairpersons can join.
Harshvardhan, please display CV of Monica ma'am. I will introduce ma'am.
Just one line is enough, Dr. Madan.
Yes, ma'am is the consultant in reproductive medicine, endoscopist at Bhopal Fertility Endoscopy Maternity Care. Ma'am is the president-elect of Bhopal Obscene Gynae Society, founder president ISOPOP chapter of Bhopal 24-27, national executive member ISAR, vice president Bhopal Menopause Society, honorary secretary MP chapter of ISAR. So many awards and so many things are there.
Thank you, Madan.
Ma'am is
Thank you
so
so
active.
much.
Yes. Welcome, ma'am, and we would love to hear you. Over to
Thank
you.
you. Thank you so much, Dr. Madan. And at the outset, I would not like to waste time, but I would like to give regards to each and every dignitary of AMOGs as well as MPOGs for having me here today, for giving me this very good opportunity of presenting a nice topic, which was very different. So I enjoyed preparing it. Of course, all my deep respect and regards to our AMOGs office bearers, President Dr. Amay Purandre sir, Secretary, dear friend Rohan Palshetkar, our chief guest, respected Dr. Sunita Tundulwadkar, Madam, our guests of honor from MP, Dr. Bapat, Dr. Base, Dr. Bakshi, and Kavita Singh, my conveners, dear Dr. Dipti, and all the dignitaries from MP, the chairpersons and panelists who have joined. And now I'll start by sharing my slides. Can we stop this screen share? Then I can start my screen share.
Yes, ma'am. Just a second.
Thank you. Yeah.
Ma'am, you can share your screen, no?
Yeah, I'll do that. Slides are visible and I am audible.
Yeah, you are
Yes,
audible.
ma'am.
Dr. Madan, you are audible.
Thank you. So we start the talk, which is more of a social talk. I'm not going to read the slides. We are just going to interact, go through all the years where we have seen our children growing, go through all the changes which we have seen in our childhood and the childhood of today. Our childhood, if we go to a restaurant once a month or something, if our parents took us to a restaurant, it was like we were just wonderstruck at the cutlery, the table, the decoration, the food. And now children in hotels or restaurant, if their families are taking, they are just seeing the phone. They're just checking the phone. In parks also, you don't see now young children playing. They are with the phone. When there is a school break, instead of playing in the ground and rushing to the school playground, girls are taking out their mobiles, boys are sitting in groups and, just looking at the social media. So this is the impact of social media. And are we heading towards a, air crash? This future is in our hands and the plane is flying. We have to see what we are really headed at. Youth mental health is a major public health concern. This is posing not only a society burden, but economic burden because we are losing that youth power. Adolescence already, Dr. Deepti has defined as the age between 10 to 90, very vulnerable age, almost like, rubber, very soft rubber, very soft plasticine. It can be molded into whatever you want. So whenever there is an impact of some new technology, it affects these minds faster than the minds of those above 25. So if we intervene early, we can have some long-term benefits, not only on the adolescent health, but all the rest of the population we are going to make in India and the world after 10 years, 20 years, 25 years. A social media is actually a digital platform. It's everything virtual. It enables users to create and share content. So your interaction is basically through comments, messages, reactions. There is a term called keyboard warriors. And now teenagers are called screenagers. screenagers. They are called screenagers because they are aging through the screen. Keyboard warriors are the people who are just sitting on the keyboard. They may have no personality, they may have no ethics, they may have no education, they may have no, sort of mindset to comment on a particular person. Still, they will type some comments on the keyboard which will defame another person. So, this is the social media, the impact it can have. Though it is an essential part of today daily life and affects, it's connecting billions of people worldwide. You have got information, you have communication, families sitting in US, UK, India, they can connect. I have my sister who talks to my mother twice a day from UK. So it doesn't feel that, she's away. There's a lot of entertainment, but the challenges are also significant. The growth has been exponential. The smartphone usage was also exponential. Easy internet access. In fact, there was a study in UK which said that the problems related to depression in teenagers and the high amount of school negligence is related to the speed of internet. When high speed internet came along with broadband, the problems accelerated because now that teenager can upload multiple images in 1 minute. Earlier, one image uploading on Facebook or any other media, TikTok or anything, I don't know how old is TikTok because I've never used TikTok, but it used to take some time. But now you can, upload 80 images, 50 images, just different lights, different filters, and people are just zapped. They are totally sort of under a hypnosis. Then came the pandemic. So COVID-19 pandemic did many things for many people. I think we went to our housework, some people went to hospital work, some people learned something new, some people were cooking, but maximum people were on their phones, not only to see about the disease and the way pandemic is, affecting people, but also they got into a lot of technology. So in COVID times, my children came from college and my son was preparing for NEET. And that time my son told me, Mom, your practice is going to change. Please start using YouTube and start making a very nice interactive website. I ignored him. I said, no, my practice is okay, word of mouth, everything, everything. My patients will come. But believe me or not, there was a significant change after COVID in the types of patients who were interacting. They were interacting through internet. You needed a brand value. You needed a sort of, propagation of what you know through internet in order to have an impact. So these are the positive impacts. A child, if that child wants, a teenager can, plan his education, learn multiple skills, plan some sort of startup. There can be online learning in communities. The resources can be pooled. You can come to know which area of your city you're having a cooking class, a baking class, a new language, whatever. Then digital marketing opportunities. Some teenagers are very talented. They can showcase their work. Somebody is painting, the other one is making some craft. Small businesses can reach wider markets. There could be a personal brand and career networking. I'm just seeing this girl who's marketing Masaba. This girl, the brand by Masaba. I mean, the way she has progressed is only through internet. Everybody is buying her things because she has sort of marketed them so well through internet. But here we come to the negative impacts. Of course, the effect on mental health. There is a lot of social comparison because when you are on internet, you are basically a real version of yourself. So when you make a reel of yourself, that is simply a part of yourself which is the best, which is presented to the public. So that real versions, when you see of thousands of people, hundreds of friends, you feel, oh my God, I'm nowhere in front of them. I'm not that good looking. I don't have a good figure. I don't have those sort of, trendy clothes. I don't have that jewelry. So this lowers the self-esteem. Then is the problem of excessive screen time. And this, I would like to cite an incident. There was, this gaming. I'll come to gaming. So teenagers were so hooked to gaming that there were about 25 to 28 deaths of kids less than 20 years, less than 25 years, while playing online video games for as much as 5 hours to 20 hours. So much is the addiction. So every time you hit the screen, every time you post a picture and somebody likes your image, you get a dopamine hit. The dopamine hit goes up, down every time. So you will not leave your phone behind. Every time you'll see, oh, 5 likes in the evening, 15 likes in the morning, 25 likes in the afternoon. And then if those 25 likes stay the same way till the next morning, then you are depressed. Oh my God, my picture has not been seen by anyone now. Then comes cyberbullying. There are some people who are, they track people who are not that strong. They can cyberbully you, especially this goes on in schools. And there are groups of girls who are, very trendy in school. There's another group of girls there's another girl who's studying all the time. So this group will bully the other group, and so on and so forth. And of course, at the end, when there's so much of dopamine released in the brain, ultimately it leads to anxiety, depression, because you're not leading a real life. There is also spread of misinformation. Whenever there is fake news, it can spread very quickly, and you don't verify it. You just forward the messages here, there. You don't know the source of information. It can totally damage the character or reputation of somebody. It can influence public opinion negatively about a person who's not like that. It can not only cause social conflict, but also religious conflict. Such young children might have religious stigmata in their minds that this is the religion, that is the religion. They might get into a conflict in school, in college, or outside. There is a significant impact on young generation as far as lifestyle and behavior is concerned. Maybe that family is a middle class family, but the child wants branded clothes. The teenager wants to have a particular set of clothes and makeup and a bike. This is just because of he's seen his friends driving that. It definitely affects academic performance because the child is not able to touch the book. Every time the book is open, they'll hardly read half a page or one third of a page and they're back on the phone. Their identity, self image is disturbed. So it actually requires parental and educational guidance. See, everybody's gone through it. Many people ask me that, Monica, ma'am, how did you tackle your kids? They've gone to, you've handled them well. They've gone to good colleges. They are there, and doing medicine. But I feel I have seen the worst phase of their growing up also. I have seen the phone, the PUBG, the behavior of my son. I have seen my daughter. So every family goes through it. It's very rare not to see your teenager going through that phone phase and internet phase. So this is what I told you. Teenagers are now screenagers. And social media has become the primary source of communication for young people all over the world. Apart not It's beneficial, but they are not taking the beneficial part of it most of the time. They are using it for their image promotion. And when we compare girls and boys, more affected by depression are the girls, because girls have got an idea of body image. They are more aware of the changes in the body. uh, 10 to 11 years, the pre-pubertal changes start. 15, 16, these adolescents have got the, puberty. And after that, they start experimenting sexually. So these girls are very much affected as compared to boys as far as body shaming, image, and depression is concerned. And boys turn to gaming. So boys are more affected by the games, especially the violent video games, and boys also fall prey to the this thing illicit drug use through internet. There are some drugs and substances which are available on the net through particular websites. So there is something called a deep dark web and a deep dark web. Again, my children have told me. So some links from internet take you to a deep dark web space place where you will find guns being sold and prostitution. You will find illicit activities. You will find violent games. So this is how the children, the vulnerable children, reach these sites. Coming to gaming, I've already told you, I've seen this video. I just saw about 2 hours back a video where a teenager started playing a video game after school, played it till next afternoon, and when he died of cardiac arrest, his hand was on the keyboard and he was still trying to reach to the mouse and the keyboard. So this is the level of addiction which can come. And then there are sextortions. Sextortions means the child or your daughter or your niece or whoever has suddenly got into a relationship, and pictures or images have been clicked, and these people, they start blackmailing the children that they will reveal their identity in school and they will destroy the career. They will tell their parents. Now everybody must have heard of blue whale. I was very intrigued, so I put a few slides of blue whale. So this was a suicide challenge thing, a game which started. It had started somewhere around 2017, 18, reached a peak in 18, 19, and then suddenly all the countries banned it, all the governments banned it. So this was a suicide game. This was aimed at teenagers, which set 50 tasks in 50 days. And the deaths of teenagers occurred due to these games. So, first, there were small, simple tasks: wake up in the middle of the night, wake up at 2 a.m., go to the terrace alone, watch a horror film, and then cut your hand, make a whale, and then you kill yourself. So, this affected India also. And then I think government took a step. She's the first Russian teenager who died. Her name is Rina. So this is the type of facial expression that children have while playing a violent game. Can you see? They're almost like sort of, hypnotized. Their reactions are intense, violent. If you speak to them in the middle of the game, they don't reply. They are not ready to leave this, whatever it's called. I don't even know what it is called, this playing thing. And look at the names of the games. The more violent the games are, the more popular they are. Sniper Elite, Friday the 13th, Resident Evil, Dead by Daylight. And then you have these games. I clicked a screenshot, 48 solo kills. Now, this is a fatigue gaming. This is a boy who has got 2 million subscribers. My gaming sprees, I have done 48 solo kills on PUBG, and these are the types of reactions he's getting. All hearts, hearts, hearts. So people are zapped. And one of the boys is just written that please use Glacier Suit one time. I'm a big fan from Maharashtra. So this boy is sitting somewhere in Middle East and he has got fans all over the world. So this is the time to, just tell. And then children were studied. There were studies, randomized control trials, longitudinal and cross-sectional studies which were done. These Facebook users, Mark Zuckerberg was called to court. He stood in court and he was, told that how come you are doing this to children? And his team said, actually, Facebook users are not depressed. It is the depressed people who turn to social media more. Social media doesn't depress them. See the answer they are given. So these companies, you won't believe me, they have got a team of the most intelligent people in the world, some aged 40, 50, 60, who just sit in a roundtable conference and discuss how violent the games can be. How can they increase the number of clicks? What can they introduce in the video game that the child does not leave it? Because this is a big industry. You can't even imagine the billions of dollars which the gaming industry earns through the games. So this is danger ahead. We have to proceed with caution. Every family has to first leave your gadget yourself. Once you leave your phone, then only you can tell your child to, leave the phone. Have some talking time, have some, no phone time. Though I know it's difficult, but the perils are also endless. This is the cyber crime, which is these few slides I've taken from Prerna's debate, that this is the type of cyber crime which is expected to skyrocket. You can see in 2018 to 2027 expected, the cyber crime has increased 25 times. It's auto-fueling and it is leading to, a lot of crime and predatory sexual activity. And these are all the ailments, which are ailments and suicidal behaviors which are associated with it. So, and anyways, if we want our children to learn about sex and sex education, it is better to talk to them, sit with them, rather than browse to internet. Because if you type sex in internet, I don't know what it will show you. It is promoting such unhealthy sexuality. So at the end, social media has got positive, negative impacts both in a modern society. You have to balance the use and use it wisely. This is a small video, a very sensible.
Love social media. Learn, meditate, advocate for causes that I care about, and watch the most meaningful videos ever. But all anybody really talks about is that social media is terrible and that it's causing mental health crisis. You don't have real friends. It's such a waste of time. You are always on your phone. So, is social media a good or bad thing? According to experts, it can be both. To create a healthy balance with your time online, try doing these four things. Stop and pay attention to your social media use. If you feel sad, anxious, lonely, or keep comparing yourself to other people on social media, take a break and stop following accounts that make you feel happy. Ask yourself, are you checking social media constantly, experiencing FOMO and missing out on time with friends, family, school, sleep? How can you use social media to feel more connected to the people you care about? Consider ways you can take advantage of social media to get inspired for things like reading art, new food, or learning more about a topic that you're passionate about. Take breaks and set screen-free times to eat, sleep, and go outside. You can also set time limits to help encourage a healthy balance of time online and offline. Remember, it's all about balance and finding out what works for you. Reach out to trusted adults if you need support figuring that out.
So reach out to adults. We have to tell our children, reach out. You have to be available to them. Once you find a child in crisis, an adolescent in crisis, they should trust you enough. They should find you available to talk to them. And if they get into some sticky spot or trouble, you should be there to take them out. It might be a teenage pregnancy. It might be, drug abuse. It takes years and years to mend the damage, and the cracks remain there, but it's not irreparable. At the end, I would like to thank Dr. Madan and Dr. Prerna for this immense opportunity, and always thank all my seniors and dignitaries for the love and support I've always got in my 5 years in Foxy. I am your fellow Foxian, humbly seeking your blessings for the post of chairperson in Fertility Committee this year. Kindly give me your blessings. Thank you so much.
Yes, thank you so much, Monica ma'am. It was really a mesmerizing presentation, comprehensive presentation. You have included everything. Very nice presentation. I request the chairpersons to give their valuable inputs. Yes, Rita ma'am.
Yeah, sure. I will definitely like to give my views regarding this. But first of all, I would like to thank the AMOGs, especially Dr. Prerna Kesan. She connected with me, and she has made me part of this wonderful program. And what to say about Dr. Monica's presentation? It was really mind-blowing, outstanding presentation. She has covered every minute detail about this, and I am really sorry to say that the benefits doesn't outweigh the bad effects of the social media on our future. Adolescence is actually our future, and their minds are curdled because of this social media. And I think they are paying the price of the busyness of their parents. The single families, now the single child norm is there. Mothers and fathers both are busy in their careers, making careers and everything. And they are left alone with their mobile. Mobile and social media is everything for them. Mobile is their parent. Mobile is playing the part of parent. Mobile is playing the part of brother or sister and the friends also. So we have to be very cautious, and we should pursue the government to please when certain things like dark web should not be like Dr. Monica said. It's very true. Dark web is very dangerous for our future children. and it should be meant for the children. It should not be in the reach of children. Many apps are there, they should not be in the reach of our children. And I think Foxy should take some steps to pursue the government to take strict action, very very in last few days, this Karnataka government has taken some decision that up to the age of 16 they will not allow certain apps to see by the children. So it should be all over India that children should, there's only few
Thank you so much. Thank you so much,
Dr.
Rita ma'am.
Monica, it was really wonderful, and all the very best to you and Dr. Archana Vasid, madam, for your future competition
Thank you so much, ma'am.
and elections.
Ruchi ma'am, are you there? Ruchi ma'am?
Hello.
Yes, please, ma'am.
Yes. Thank you so much. I am joining in between. Actually, I am in Madurai right now. I'm joining from there. So
Okay.
I listen just half the part, but Monica, as always, amazing. बहुत अच्छा presentation था. And I am also going through the same problem. My younger one is just 17. And really, it's a big problem nowadays. And like Rita ma'am said कि जब से हमारा सिंगल फैमिलीज हुआ है तब से ये प्रॉब्लम बढ़ा है क्योंकि बच्चे अकेले हैं, पेरेंट्स आर वर्किंग, वी हैव हार्डली हैव टाइम फॉर देम, सो इट इज अ रियली बिग प्रॉब्लम. एंड मैंने जितना सुना, हमेशा की तरह बहुत अच्छा प्रेजेंटेशन था. थैंक यू सो मच. एंड थैंक यू प्रेरणा, इतना एफर्ट्स आपने डाला मुझे इसमें इंक्लूड करने के लिए. थैंक यू सो मच.
Yes, thank you so much, ma'am, for joining. Yes, thank you, Monica, ma'am. Once again. Now we will move forward to the panel discussion.
सब ठीक चल रहा है ना, भाई आ रही है. कल हम लोग पहुंच जाएंगे रात को 9 बजे तक इंदौर. तो कल तक तो कहेंगे भाई रहेंगे तो तुम आ रही परसों स्कूल पर आ जाओ. दे चिंटू को छोड़.
Okay, our topic for panel discussion today is the psychosexual issues in adolescents. I think most of the issues we have discussed, Monica ma'am has very much covered every issue about this social media and its impact. And also Dr. Dipti has covered the teenage pregnancy and its complications. So I would like to welcome both experts for this panel, Dr. Jyoti Banglowala ma'am, who is the chairperson of Foxy Ethics and Medical Legal Committee, and dear Brajbala Tiwari ma'am, who is the Foxy chairperson for Environmental Health Committee of Foxy. We welcome both of you and our esteemed panelists. Next slide, Harshvardhan. Yeah, next slide. Dr. Professor Sumitra Yadav ma'am, who is the president of Indore Obs and Gynae Society and professor at MG, MMC and MTH Hospital Indore. Welcome, madam. Next, Dr. Nidhi Jain ma'am, who is the honorary secretary of Sagar Obs and Gynae Society. Next, Dr. Anju Verma ma'am, ma'am is the secretary of Gwalior Obs and Gynae Society, vice president of in the past and vice chairperson of MP chapter of ISAR, and also organizing secretary of MPSR conclave in 2023. Welcome, Anju ma'am. Next, yes, Dr. Roma Nag ma'am, who is the consultant of and Gynae at Nirmal Hospital, Kanchighar, currently secretary of Jabalpur Obs and Gynae Society. Welcome, Roma ma'am. Next, Dr. Archana Maheshwari ma'am, who is the Honorary Secretary of Ujjain Ops and Gynae Society. Next, Dr. Rekha Singhal ma'am, who is the Secretary of Riva Ops and Gynae Society. Welcome, madam. Yes. Yes, next. Yes, Dr. Swati Jain ma'am, who is the Honorary Secretary of Katni Ops and Gynae Society. Yes. So, let me share the screen. I welcome all the esteemed experts and panelists for this wonderful panel. I am sharing the screen now. Is it visible?
Yes, visible.
Yes. Prerna, are you there?
Yes.
Okay. Okay, everyone knows what is the period of adolescence and what are the problems just we are discussing, and it is the endless issue. There are so many problems in adolescence, so that's why we have to address this adolescent period or adolescents very gently, like glass. We have to handle them with utmost care. So many factors influence this sexuality in the adolescents. Most important is the gender identity issues, sexual orientation issues, and the culture they are living in, and how their body develops. These are the most important factors which influence on the adolescent sexuality. During the adolescent, an individual's thought, perception, as well as response gets colored sexually. Puberty is a very important landmark as far as the development is concerned. And there are so many changes occurring, maybe physical changes or psychological consequences are there, some emotional factors are there, and we have to understand this adolescent health issues because it has some very important clinical, legal, social, cultural, as well as educational implications. There are biological changes in the puberty due to hormonal effects. Uh, there are secondary sexual characteristics, some psychological and social changes which are affecting sexuality, like cognitive changes are there, emotional and social changes, and behavioral changes. Other factors again come into play, that is sexual orientation and identity conflicts are there. Some psychological factors like stress, anxiety, guilt, depression, trauma. As far as the sexual issues are concerned, there may be loss of sexual desire or pleasure. And most important is the to tackle the myths and misconceptions about the sex in the adolescence period. And again, a worrisome part is the pornography and its problems regarding that. Other issues like menstrual problem, childhood marriage, early and unprotected sex, sexually transmitted infections, teenage pregnancy and its complications, unsafe abortions, sexual abuse is there, some addictive behaviors that is again rising very much, and last that is the depression and suicide. So we are discussing in subsequent case scenarios. Straightway we will go to the some discussion about the practical discussion we will have about the some case scenarios. Everyone can give their best inputs because these are totally practical points. Just we have many points have been covered in the recent two talks. One 16-year-old girl presenting with excessive use of Instagram, that is social media, more than 6 hours per day. That means she is addicted to that social media, and there is constant comparison with the influencers. And she feels ugly despite her normal appearance. Now she has started avoiding the gatherings and social school activities also. She is feeling alone. Then I would like to have the inputs from the experts or the panelists. Is this normal adolescent behavior or a concern? And how this body image affect the adolescent girl clinically? Yes.
Yeah, actually, and Dr. Madan, it's very,
Yes,
very
ma'am.
important and it's very common nowadays because at this age, it's very tender age. And the thing to compare with each other is really common, even between the brother and sister and cousins also. But on seeing this on social media, because there are so many filters and so many things, they compare with that. So this time we need to explain them that everyone has unique thing in them. It's not only the appearance that is important. So this is really, as you said, it's very, we have to handle with care like a glass.
Yes, ma'am. We totally agree. Yes, anyone want to add something?
Well, if the body changes are mild, they are normal in any adolescent. But if that girl shows withdrawal symptoms, it is an emergency, and it needs evaluation and proper counseling, taking the girl into confidence.
Yes, how will you counsel such if parents came with this adolescent in your OPD, then how will you start the counseling?
I think we should not scold our children, whether they are boys or girls, and we should listen all the things calmly, and then we should counsel our children to suggest that it is a social media, and you are just comparing herself or himself to such like, but it is not a real world. So we should listen our children very calmly and not scolding. And many a times it is seen that children having real problem, like you can say gender identity disorder. We should differentiate between the two things. Whether
Yes.
they are feeling that his or her body is not appropriate, or it is a real problem, or just his or her imagination. It should be very crucial. We should always think this type of this may be a disorder.
Yes. One more therapy during the counseling is cognitive behavioral therapy.
Yeah.
Now, what is this CBT? We have to address the negative thoughts. That means we have to remove their negative thoughts by counseling, and we should start addressing positively, that they should have the positive thoughts, and the confidence which they have lost, that we have to rebuild again, and we have to again give them confidence, and we have to distract them from the negative thoughts. That is very much important. And
Yeah.
as you have rightly said, we don't have to scold them, and the manage very gently. And the role of parents is very much important in this, along with the clinicians.
You have to be openly communicated. Means your communication with the children should be there.
Yes.
Family
Provide
have a
safe
very good
counseling.
role. Family
Yes, yes.
should be very supportive.
Yep. Role of parents is very important, because
Yeah.
they are in contact with us for half an hour, 1 hour, but uh, they are in contact with the parents at home. That's why their role is very important.
Yeah,
Monitor
parents should
screens and
avoid.
rent.
Yeah, parents should
Yes.
avoid criticism. Actually, parents are like when they people are comparing children with other children. You should avoid comparison and criticism, and you should cut short the screen time basically, because the screen time is too long nowadays.
We have given mobile in their hands since COVID times.
Yeah.
Then it is showing the long-term effects now.
Yeah.
Okay. Uh, Yes, one more case related to this. A 15-year-old schoolgirl who is in a secret relationship with her classmate. Um, Increasing phone use and secrecy also, and she has started decline in her performance in academics. Now she is fearing that parents will find out this problem. So she is in very confusion, somewhat depression. Then what can be done in this case? Is it normal at this age
Yeah.
to have a romantic involvement?
Yeah, at this age group, the attraction towards the opposite sex or some friend, it is normal. And you can say that is normal. But concern arise when the academic involvement is decreases, like she's not going to school or not going in social gathering and all. So she needs some guidance, but not the means punishment all.
Yeah, don't punish. But two important qualities are there in the adolescence. We find that is the curiosity and attraction.
Yeah.
In this period is so high about anything, about anything. That may be a good
Yeah.
thing or bad thing. That you have rightly
Bad thing
pointed
is
out.
potential risk of this may be early sex activity, unprotected sex, impending to unwanted pregnancy, STIs, unsafe abortions. So we have to counsel her.
I think
Really,
we
it is
should
a
educate
very
about the sex education of children
Yeah.
at this age, so that
that is yeah.
these all
There
the
comes
complication can be avoided.
yeah. There comes our role to give this accurate
Appreciate
sexuality education, good
at
sexuality
right
education
time.
in schools and colleges, to avoid the early sexual activities. To if at all they are having, they should have a protected intercourse. Many.
Protected intercourse. Yeah.
But we cannot advise openly that you should have an protected intercourse. We cannot advise. But still, the incidence is so much high. And that is why the teenage pregnancies are happening so much. There may be incidence of some sexually transmitted infections. That we can give them the education, right education about the reproductive health also. And age appropriate sexual counseling is very much important, because these adolescents are emotionally dependent. There is anxiety, risk of depression is also there. If the relationship breaks, then again the problems are going to rise. So our role is very important. What is the role of school in these cases? Is there any role of school or teachers in such cases?
Yeah.
I think in
Yeah.
school also there may be many people advocate that sexual education should be a part of school curriculum activity, but many pupils not promote this. But I think there should must be a balance. Something should be told to the both male and boys of the adolescent even when there is starting of the puberty. All the
And
children.
we should,
How?
yeah, and we
In
should
this
keep
case,
watch on students also, whether they are regularly coming or they are taking part in academic session or not. You should do confidential counseling also, and behavioral changes. You should watch on
Yes.
the behavioral changes also, and you should teach them properly about the healthy relationship between the friends and emotional well-being and everything.
One thing is school and teachers can do that, they can ban the use of mobile in the school. They can ban.
Yeah.
yes.
And many times we often observe that students carry the mobile, lecture is going on, they are sitting behind and watching the videos, and they are busy in the social media. They are
Yes.
unattentive to the academics. That is the fact in larger schools. But school can control this much with strict vigilance. And parents should also do this. Any legal or
Yes.
safety concerns are there? How we can educate them about the legal aspect?
POSCO Act should all the adolescents should know the POSCO Act.
Not only adolescents but parents and teachers should also
Yeah.
know. And there is our role whenever we go in the schools and colleges to have some lecture to the adolescents. We must include this part during the this lectures or talks. We have to just introduce, at least there is something POXO like act, and what should be done, what should not be done, that we should address at least in the schools and colleges. Many times teachers are also not knowing, adolescent students are also not knowing what is POXO Act.
Yes.
Yes. Dr. Prerna, are you there?
Yes, yes.
Aha. Can you take this?
So, yeah. So, reeling into the esteemed panels and really looking ahead with for a steaming discussion. We have this case scenario 3 where it's about sexting and digital risk that are involved with it. So we have this 17 years old boy, and we have the question. The previous, yes. 17 years old boy who have shared intimate photos with his girlfriend, and the image is circulated among the peer group. Now he is anxious and fearful, and he has withdrawn. He was withdrawn in his behavior, and is avoiding school. So anyone, Dr. Anju ma'am, Rekha ma'am, Roma ma'am?
Main concern is acute anxiety and psychological distress, social withdrawal, risk of bullying, humiliation, and needs urgent emotional support.
We have taken a thorough talk on this by Dr. Monica, but we can hear from our panelist, Dr. Anju madam.
I
So
think when
counseling
there,
is important.
yes, whenever there is symptoms of acute anxiety and distress, we should always take it very seriously, and we should treat such type of the children early and counsel them properly. We should not. I mean, there is no era when patient should or parent should scold her children. Every time it should be very calm, communicative efforts to deal such type of the children.
Very true, very true. So we have talked about the concerns and
We should guide only, do not control.
Yeah.
yes. Dr. Roma ma'am, can you let us know what does the school has a role to play in this, because it has been widely circulated amongst all the students now. If the school has to take a call.
As we all know, teachers, they are secondary mentors. So age appropriate education about puberty, reproduction is very important. And they should teach us consent and safety also. We should create in school non-judgmental space where they can ask their queries. They are very emotionally unstable at this stage. So we have to recognize the sign of distress, abuse, and behavior changes. School should provide a counseling environment that can address the emotional and the psychological sexual concern. We should, it is the duty of a teacher that can encourage the respect, equality, and the inclusion among the children. And always rebuild confidence level, and guidance and support should be given by the teachers.
Yes,
In
very,
this,
very
yeah, in this case, I mean, school can play a role, avoid the harassment, bullying, keep it confidential, and stop circulation of this content which that boy has shared.
Yes, because that is a legal offense again.
Yeah.
Can anyone throw some light on the legality issues associated with this? The
See,
legal issues
sharing,
as
yeah, sharing intimate images of minors as a offense and serious legal offense under POCSO Act. Even forwarding images is punishable. It is important to stop further circulation. Once school also should stop, and we should educate them that this is not an appropriate thing, and we should inform to appropriate authority if possible.
this time it was done. So
Yeah.
in future, can the school or the parents or
Yeah.
maybe the care providers can use a way in how to prevent this particular
Yeah.
scenario in near future?
Awareness program should be there in the school
Yeah.
about sexual activity.
That is
And
responsible
you
online
should,
play.
yeah, you should educate adolescent that digital footprint is permanent. If you are sharing something, it is permanent and can circulate on social media. So never share your private moments or any content on the media, and promote online means responsibility about the online sharing and all. And you should educate them. You should make them aware of this.
We can have this very interesting scenario where you enter 16-year-old son's room. Maybe any of our panelists who have a young adult boy at home can understand this. So you found the son masturbating. You have entered into the son's room without knocking and you found that he is masturbating. So what next? You have come face to face with him. So you'll counsel him, you'll confide him, you'll ask him normal questions, you'll behave abnormally, or you just walk off. What will you do? How will you approach this?
I
We
think
have to counsel.
we should not react just like this is very abnormal thing. Just
Yeah.
see and counsel with boy and say it's normal. It may happen during puberty time or the phase you are going to through this. It's normal, but we should also educate that what may be many times children see the pornography, so we should counsel the patients it's a normal desire, normal changes in the body, and it's a normal thing, so that the child should not go in the guilt phase. That's I am very abnormal or I am doing anything which may create problem in my future. So this is our duty to sit our adolescent boy and to counsel all these other things.
Madam, open communication is very
Yeah.
important in this. We have to communicate.
Yes.
Yeah.
Boy should not hesitate to discuss with her, with his mother and father, so that everything is very open, so they don't feel just like there is very abnormal thing.
They'll let you know everything if you are open with your kids.
Yeah. They also share all the things
Yeah.
with us if we are open.
We also need to tell them about STIs because they also
Yeah,
get
sexually
fearful once.
transmitted
I
disease.
should
They
use
have
should be hygienic. It should be hygienic.
And it also doesn't mean that you are that free with the kid. Like in the previous 1 or 2 episodes, we had few panelists who had raised this concern that a parent has to be a parent as well as a friend, but a parent cannot be a friend always. So you have
Yeah.
to have that amount of strictness also, otherwise they'll take you for granted. So that is also a very important factor here. You have to balance both the issues. So should sex education be a part of school education? We are under the Young Talent Promotion Committee under Rohan. We are doing this sex education for schools across India and with thorough permission. So do you think that's the right, what is the right age for these students to learn things?
It
I
should be
think around
started
age
at
of
the
puberty. 8 to 10
before
years.
the puberty.
Okay.
It should be before the
Start
puberty.
before the puberty.
Usually from age 9
I
onwards.
think from
8 to
the
9.
yes, 5th, 6th class, the starting of the this adolescence. 10, I think 10 is better, but nowadays because of the increasing all the awareness, even 6 to 8 year children also seeing all those things. So it may be from 8 years also.
And who can be the right person to teach them? We as a gynecologist or the teachers around?
I think in school there is also only availability of the teacher.
Students always thought that whatever the teacher teach is always right.
In this context,
Some
ma'am,
part of parents is also there, and they should also teach means right from starting. Means
what
after
we
8
want
years.
to emphasize here, being Dr. Madan being the chair, being the national coordinator for the Sexual Health and Transmission Committee, and myself for the Young Talent Promotion Committee, we want to emphasize here that we should take it forward from our end as gynecologists and care providers, where we can start certain projects or certain impactful way of teaching the students way and in the schools with our permission that okay, we are the ones who know about reproductive issues the best. The teachers know about academics the best, but we are the ones who know about reproductive issues the best. So we nobody better than our trained gynac who can train the younger generations on how to deal with their body and their sexuality. So that is it. And we can have the next slide, please. You can take it from here, Dr. Madan.
Yes. Yeah. There is one interesting scenario. Again, Dr. Neelam ma'am is there. If she wants to take. Yeah, welcome ma'am. 19-year-old unmarried girl comes for consultation. She is in a steady relationship with her boyfriend and she wants to take the things to the next level. And she wants contraceptive advice from you. How you can guide her? How you can manage this? Yes. Yes. Neelam ma'am?
Hello.
Please ma'am.
Can you
Yeah,
hear
what is
me?
your opinion?
The basic thing actually starts with the sex education. And the first thing we have to tell them is about the hygiene as well as the barrier protection, which is very important because it not only prevents from the unwanted pregnancy, but also from the sexually transmitted diseases, which is a very important part in the teenagers. Plus, usually these patients come with recurrent vulvovaginal infections and very bad vaginal discharge and all. So we have to tell them about the hygiene, sexual hygiene and barrier protection and contraception. as well as the loyalty to the partners should be, I think, maintained.
And we should take proper history. Means whether she is going for a regularly relation or sometimes or sporadic, and you should take his sexual history, whether she has single partner or multiple partners, and frequency of intercourse, how many times she is skipping relation, once in a week or twice in a week or whatever. And you should about the, as madam said, that you should explain about the hygiene and means sorry, means contraceptive knowledge of contraceptive, their side effects, their failures, everything.
And these patients actually are the very prone for pregnancies, and they take. I have seen that they would take unwanted pills or pill 72 this thing emergency
Very
contraceptives
frequently.
very frequently, because they think that is the part of a routine. They take it as a routine, which we have to discourage. Actually, that is not a routine thing. They have to take it only as an emergency, and regular contraception should be used. Otherwise, it will create problems in their periods and everything. As well as we have to tell them about the if by chance they have urine test positive, then they have to consult a gynecologist, not to quacks. Usually they come in contact with quacks and they tell them to take medicines which are not actually recommended, and RPOC, they come with RPOCs, very bad infections
Heavy
and
bleeding.
pain products, heavy bleedings, anemias. So we have to tell them, because whatever happens, actually it's our duty to help them. Otherwise, they will be caught in the quacks also.
Yes. Yes. As
So
you
first of
are.
all, we have to tell about abstinence. अगर वो नहीं मानते हैं, then we have to tell about contraception.
मैडम वो तो हम बताते ही हैं, लेकिन आजकल तो उनका सबसे पहला कहना यही रहता है कि भाई आजकल तो ये बिल्कुल कॉमन ही है, हम तो अवॉइड ही कर सकते हैं. फिर आप क्या कर लो?
आजकल
सेकेंड पार्ट तो हमारा यही रहेगा.
Then they will go under POXO Act.
So that we have to tell her, like she is not under POXO, but
Yeah,
she is
she's
19, but she is
It is
unmarried.
19-year-old. She is.
She is already in relation, but
We cannot say anything because we cannot force them not to keep relation, but we should advise how to keep an a contraceptive should be used and all.
I think this is the right time. We should counsel them also that we should discourage multiple partner always.
Yes.
What we
Single
can-
partner to tell about the risk of sexually transmitted disease. So this is the right
Yeah.
time when such
Yes.
type of boys or girls come to us.
As far as this case is concerned, we have to be stick up to this part, sexually transmitted infections, avoiding unwanted pregnancy and its complications, avoid multiple sexual partners. That
Dr.
much.
Madan.
Yes.
Yes.
Dr. Madan.
Yes. Yes.
Here, I would like to just state one very interesting thing that happened to me just a couple of days back. One of my
Yes.
known to, she was from a metropolitan city, not to mention which one. She said that my kid is 18. He's a boy, 18 years old, and he is on to sexuality. Like he wants to have sex with girls. So they have such situationship sort of a thing, and then they have one night stands at the clubs and all. So what I have done, the known to told this to me, that what I have done, that instead of asking my son to go on with the clubs and have sex with girl, rather than bring that girl home, because that will avoid all the hassles. So just imagine. Because home is a
क्या
safe
दिन आ
place.
गए मतलब?
Home is
क्या
a
दिन आ गए
safer
मतलब?
place. Home is a safer place. I banged my head. What is all these? Then this is
Very
like normal.
advanced parents.
Very advanced. Like it's better you bring girls on
It's okay when she is actually he or she is in a
going to the
serious
club.
relation.
Too much.
Actually, that is okay only when I think if they are in a serious relationship with someone specific one person,
Ma'ams,
then it's okay.
one night stands, that too allowing their one night stands at weekends at home. Just
My
imagine.
goodness.
This is the
What are up to?
what has happened to the society.
Yeah.
That is the only thing, really.
Yeah. Yeah, so Dr. Madan is a bit busy. So, how parents and doctors, they are your best friends. You have seen this question that this particular girl's parents and Dr. Madan, you were on to it.
No, continue.
Fine, not an issue.
Okay. ठीक है. In this case, if her parents are doctors and your best friends, what will be your take?
We
Everyone
should
can
have
give frank opinion.
confidentiality. We should
Everyone's
have
opinion.
her confidentiality.
Yes. Yeah. Another other panelists. What do you
As
say?
well as I think we should take in confidence our children so that they can share any problem or anything with us, because that is a very big problem nowadays. They don't tell us anything, and sometimes very actually mess happens, and then we come to know that probably if I would have known this thing in a prior, then I could have helped. So I think they should be. We should take them in confidence, whether it's a boy or girl, especially the girls, so that they can share any problem, even the sexual problem, with us. So that at least we can come to know about their problems. Otherwise, they don't share with us. They tell others. They seek help from others, and are caught in a troublesome situations many times.
Then what about your friendship with her parents? Is it not your duty to tell her parents what to
पर
do?
एक तरफ कुआं एक तरफ खाई है.
I
Then
think
what we do? What
we
should we
can
do?
tell if their parents our friends, but we should keep it in confidential. And we should also tell all the children who comes to us about the legal boundaries. It's must duty, because if
But
they
that,
get in
but
trouble,
madam,
then we are
उस
that
लड़की
we
को
can
पता है.
implement only, that we can implement to our children only when they we will behave like friends, and they will be in our confidence, so that we can with love tell them that it's not right thing, and try to avoid these things and all. Otherwise they won't hear. Then definitely teenage pregnancy, teenage persons, you know how they are nowadays.
Dr. Madan, what do you say in this case when your friend is doctor and means his or her son has done this mistake? So
देखो
we
अभी
should
इस लड़की को पता है कि अपने माँ बाप क्लोज फ्रेंड्स है, फिर भी वो आपके पास आई है. Why she has come? So that's why we have to honor
she has
this thing,
we
and
have to honor her
at the
confidence
same time we have to guide her, counsel her.
properly.
कि, she can, if she is serious in her relationship, she can approach her parents well. And as far as the medical part is concerned, we have to maintain privacy, confidentiality, her safety regarding the STIs and protection, everything. But at the same
Also,
time,
there is
she has to be open with her parents too.
Parents also, yeah.
But we
also
cannot
there is
be judgmental in this case. We cannot be judgmental in this case.
Dr. Madan,
As
there is an RCOG guideline also on this adolescent contraception, where this girls this confidentiality has to be maintained by the rule of the law. You cannot
yes,
break it to the parents.
But if age is less than 18, we should not.
Even if it is, that is an RCOG guideline. Even if it is less than 18, if she has come for contraception, you have to maintain the confidentiality, even if she's 15, even if she's 14. From 14 to 18, that is a gray zone, but RCOG says that you have to maintain the confidentiality. Teenage contraception.
But what if she gets pregnant? Then we have to tell their parents, na?
That
Means
becomes
under
an
COPSO also, if it
Because
if
it
it
may be
is
otherwise
less than
problem
19.
for us also.
then we
Then
can
I'm
guide.
just quoting one
Many
guideline.
times, when they become pregnant, they take unwanted or miso and mifidest and come with RPOC only. They are
Yes.
so
Yes, the
smart nowadays.
practical scenario, the
They are very
practical scenario is
intelligent.
very big.
Then also we have to register under
Inform.
POCSO.
Yeah, under COPSO.
Now these kids know everything. Emergency contraception pills and everything, they know where they can get, which type of pills are there, what is the dose, everything they know.
LGBT.
Okay. So, are you taking the Prerna?
Yeah, okay. So this is a scenario 3 where we have a 20-year-old female student who comes to your clinic. She recently had an unprotected intercourse with a new partner. She had earlier a partner who was a fixed partner, but now the recent intercourse was with a new partner. Now she has had 2 other partners in the past, so this is the third part. So she's asymptomatic but worried about contracting infection and asked that you test me for everything. She's asking you test me for everything. So how do you approach this case and how will you manage this patient in case looking at her sexuality profile? Dr. Rekha ma'am, Dr. Neelam ma'am.
I think this is a very good time to tell her that this is not the way she should have her sexual life start and proceed, because she can get any infection, especially HIV, anytime. If the person she is having sex with is um, having relation with other girls also, so there are many so there are much more chances of getting her HIV and other STD infections also. So this is the best opportunity. I think we should counsel her to use barrier protection and contraception and avoid sex with so many partners
This is
when
the
she is
best
worried
time,
already.
I think. This is the best time when she or he worried about the sexual transmitted disease. This is the correct time. We should counsel that it should not a good. We
How will
should.
you start? How will you start in this case? We have to start from the detailed history. We know
Yes,
she
sir.
is having multiple partners, but we have to just go into the deep that which type of intercourse they are having, if they are using protection or not, and as regards this, she can contract any sexually transmitted
History,
infection,
yeah.
and it's
Yes.
our duty to
Treatment.
give
Yeah.
her knowledge regarding that.
Contraceptive. Yeah.
And then next step is to the investigation.
Contraceptive.
He has come for the
Invest.
investigation, but to give education is our duty. Okay, and we have to ask its symptoms, and depending upon the symptoms, we can advise some blood tests for that.
Very
Okay,
important, we have to keep in mind the
yeah,
window period because once negative,
yes.
she has.
Yeah.
So every gynecologist should know these 5 P's, which are very much needed for the sexual history taking. Details about
Yes.
partners, details about the practices, details about the protection,
Protection.
ways of
Hmm.
protection, whether they are having the
Yeah.
knowledge of any protective practices, if there was any
Hmm.
past history of sexually transmitted infections or the treatment if they had taken, and
Hmm.
whether they are having any knowledge to prevent the pregnancy or about the contraception. This is very much
Contraception.
important.
Okay. Hmm.
But I think, Dr. Madan, still now we are not asking anybody to number of partners in the routine.
That is why we
It
are,
is
That
not
we
our
should ask.
history. In
We have to
history,
start asking,
yes,
yeah.
ma'am.
So after
that is
this
why, that is,
panel discussion, we have to add this.
The
In
history taking
history,
has to,
how many
that
history
is
taking
partners
the,
has
you
to be
have?
updated.
that is the objective of such academic platforms or webinars, that
And
This
ma'am
our
is
also,
very
gynecologist.
ma'am
important.
also very important, Anju ma'am, you have correctly cited how many partners and male to male, female to female,
Female
male
to-
to female.
But
Yeah.
I think it's very scary type of situation that number
Because
of
one
partners that
adolescent,
will be.
yeah, one adolescent, 5 years back, she came to me, she was a lesbian. Now suddenly, 1 month back, she came to me, she became heterosexual. Now, what will happen to her?
Uh,
She was in hostel. When she was in class 12th, she said, I am a lesbian. And she proudly said that I am a lesbian. And she came with all sort of lot of big watch and then hat and like the cap. Boys used to wear a big shrug like this. And she sat in front of me with her legs on her other leg, like boys used to sit, na? This and a
Mm.
little hefty, just chopped off hair. That time she said that she was lesbian. But then again, this time she came with long hair. And then I said, you look so changed. And she said, I have become heterosexual now.
So it's a good thing now. From lesbian to she convert heterosexual.
And still, but I felt that she's still confused.
This is the disadvantage of social media.
Yeah,
Yes.
definitely,
Yes,
definitely.
all the children are confused about gender
Nowadays,
identity.
youths are taking
Especially,
disadvantage more rather than advantage.
Yeah,
especially this gay kind of
yeah.
thing is going on so fast in metros,
Yeah.
na? My son was telling me that we are having so many patients with big, large lymph nodes in inguinal region. And nowadays we have we made this a practice. So if anyone comes to us with inguinal lymph nodes hard and big, we ask about the whether he is a gay or not. And 90% times it's because of the that thing only.
And ma'am,
It
what
has
we have
become
seen also, what we have seen, a lot of media houses and lot of movie makers, they are also promoting this a lot.
Promoting this.
Yes.
yeah, definitely, definitely.
So that
This is
always
not our
adolescent
culture.
comparing herself or himself in which category they fit.
The recent
Definitely.
you have all seen the recent movie Accused, Konkana Sen movie.
Yeah.
Yes, she was a like designated doctor, HOD,
Doctors, yes.
shown as a lesbian. So that really much.
इवन बधाई 2 मैंने अभी देखी आयुष्मान की मतलब दे वर प्रमोटिंग सो मच ऑफ मतलब हेटेरोसेक्सुअल आई वाज रियली वरीड कि क्या दिखा क्या रहे हैं और मतलब प्रमोट कर रहे हैं उसको बिल्कुल ऐसा प्राउडली
that is it.
या एंड हस्बैंड वाइफ बोथ आर प्रमोटिंग कि हस्बैंड को भी कि हाँ तुम भी फ्री हो और वाइफ को भी कि तुम भी फ्री हो उस टाइप के रिलेशन के लिए सो व्हाई यू आर गेटिंग मैरिड ना यार
मैम ये वाला जो पैनल है ना मैम ये पैनल है ना ये AICOG के मेन हॉल में लगना चाहिए एक बार.
Yes,
This is not
madam, exactly.
actually this is not our culture. That we have to tell our at least our children that this is not our culture. Yeah, this is not
We
our
people
culture.
are,
It should not be promoted.
our
home
children
steam
are
करने लगेगा. It's so
adopting
very
Western culture. We people are adopting Western culture. They people are adopting our culture. They are going in yogas and everything.
and Western culture adapt करके भी आप उस पे भी stick नहीं कर रहे हो ना main
हाँ वही उसमें भी है ना मिक्सचर बना दिया है.
Three one लगे.
Okay.
Yeah.
As we are short of time, we will finish in 5 minutes. This is one of the important case scenario in school. School authorities once reported that some students of standard 9 have been caught watching porn, and they want you to address the students about the same. Then how will you address, and what will be your take in such cases? How you can address the students regarding the porn?
So it is a addiction, addiction of social media, and a student may indulge into early sexual activity by seeing this.
Yes, but we have to address all the students very calmly, coolly, and at the same time, we have to counsel them regarding the bad effects of porn, and they should refrain from this
As you
porn
earlier said,
addiction. And
phone should be avoided in
at the same time, use of social media and use of mobile phones should be restricted. That can be
In
also
the
addressed
school.
well.
Yeah.
Yeah, and we have to address all the complications as far as these sexual life is concerned, behavior is concerned, some psychological factors. Again, it has impact on school performance also. That we have to address, and the bad effects of this excessive use of internet and pornography. That we have to address well.
Yes, sir.
We have Monica Singh also joined. You are there. You can
Yes.
also put your input.
ब्रजमाला मैम है क्या लेफ्ट हो गए पता नहीं
मैम का मोबाइल स्विच ऑफ हो गया.
I am there, but I'm in a very
Monica
noisy.
ma'am. Yeah,
I'm very
Monica ma'am.
surrounding is very noisy, but I'm there. I'm listening to you all.
Okay.
Fantastic. Yeah.
So, just ma'am, can you highlight on this? What are the social and behavioral implications about this? What are the social and behavioral implications
Of
the
heard the
pornography?
question, I think.
This regarding the excessive use of social media or pornography. What are the implications?
See, it is a form of addiction, and whatever I studied today was that, it actually, when you watch such a social media, especially when gaming activities and pornography, it triggers a wrong area of your brain, so it leads to addiction. In fact, addiction of gaming and all these illicit channels is said to have same sort of addiction value as smoking and cocaine abuse. And it is like a substance abuse. So such is the risk. And everything depends upon, like, you have to, like Dr. Madan, you said, very gentle counseling. First of all, you have to become a friend of the child who is troubled, and you have to make that teenager trust you enough, and then probably, like, then start counseling one day at a time. Take that person, that child will respect one person. It may not be the parent. That person has to come close to the child or the teenager, and form a support group is necessary. It will not happen in one day. And then we have to take the help of child counselors, psychologists, family, integrate everyone, and gradually wean away the child from this menace.
Yeah, I would like to highlight these lower one three challenges that are now rising so tremendously. Sexual abuse is rising. At the same time, misconceptions or myths regarding the sex and drug addiction. Drug addiction is so much rising in this adolescents, and that will be a great challenge before us henceforth. Just we have covered this. Just how to address the psychosexual issues. The last is the what is the role of family and what is the role of society. So definitely there is role of parents, role of every family member, every society member, like brothers and sisters are also there. There is role of each and every relative, every friend, family friends, teachers, any coaches, healthcare providers like us, religious leaders. Everyone is involved in this. At the same time, there is role of politicians, journalists, uh, etc. Managing all these adolescent health issues. At each step, each one has different responsibilities, and everyone should follow this thing uh, to manage the adolescence.
We can
So
have one take-home message, Dr.
yes,
Madan,
one
from
take home from every
each of the
panelist.
one joined. Dr. Rekha, madam, you can start.
Yes.
So there is a recent case in Delhi. Three sisters, sir, write a note कि उनके पेरेंट्स ने उनसे फोन छीन लिया बिकॉज ऑफ गेमिंग एडिक्शन नाइट में 2 बजे, और वो तीनों ने नोट लिख के तीसरी मंजिल से कूद के अपनी जान दे दी अभी 2-3 महीने पहले, एज मोनिका मैम सेड,
Anju ma'am,
बिकॉज ऑफ
one take-home message.
Actually, I can't listen what
Any
you asked.
take-home, any take-home message on this particular panel on
Anything you want to say.
Actually, regarding this topic, I can say this is very important topic and should be discussed. Just like you say that it should be in a big hall, because many a times we are just talking about the all medical diseases, pregnancy diseases, but this is a very important topic, and it should be the era. We should discuss all the things. We are just telling that it should be in school education and here and there, but it should first discussed with our all fraternity that how can we implement this in a teenage adolescence for psychosexual behavior, because I know that men nowadays there is a identity disorders, gender identity disorder, body dysmorphic disorder are increasing rapidly. 1 in every 10 child having this problem, that body images, and whether he is trans male, trans female, or her gender. So I think it should be discussed openly in every gynae forum, and we should convey what may be the correct way to counsel the all adolescent, and we should have such type of the topics regularly, so that children and adolescent also are not confusing and not shying about discuss all these things. Even gynecologist also not discussing these things in a normal way.
Ma'am.
Yes. Yes, Roma ma'am.
We should give open and friendly conversation with your children. We should give space so then easily discuss the issue with you only. They are very immature in this stage. The open communication is very important for teenagers.
We also have one, madam. Madam, you.
We should.
Yes, ma'am.
Yeah. In my opinion, take home message should be like when you should cut short the screen time. you should, means gynecologist should take sessions in schools, like in adolescent age group. You should educate properly about all the things which we have discussed, and we should have open communication with the children. But we have to be parent at the time of parenting, and we have to be friend at the time of friendship in some trouble time. That's all.
Yes.
Monica
Thank you.
ma'am.
Yeah, I have a suggestion. It just came to my mind that let us have on our forum one child who has come out of this abuse, one child who has combated it willfully. It may be a 15, 16 who has had past experience of either pornography or relationship or drugs, and how he or she combated. That could be the leader of the group. And that leader of the group could tell the other children about his or her story, because children will listen to that
Yes.
group.
Children.
Very nice.
Very
Yes.
nice idea.
Yes.
Neelam madam.
As well as I think in the schools or colleges also there should be a counselor who can help such students in their need, and there should be regular counseling about the sexual education and all, because many times children don't talk to parents, and they are not so free to talk. They want some teacher to confine, or someone else from the apart from the family, to whom they can confide and tell their problem. So there should be a counselor, I think, in schools or colleges to help them.
Very true. So Dr. Madan, you can show our appeal slide. By the time I can give my vote of thanks.
Yeah, and then I have already shown, and everyone has agreed to support us.
Every good thing has to come to a conclusion, and it's customary to extend our vote of gratitude. So we are thankful,
Yes.
immensely thankful to everyone
Yeah.
who has joined it.
And I think in every
Chief guest,
in at the end, in any situation, whatever the children has done, it's our duty as a
panelists,
gynecologist to help
speakers,
them.
my co-convener. It's a huge success. Am I audible?
Yes. Thank you once again.
My best wishes to all.
Thank you.
Yes. Thank you so much. Thank you so much,
Mine
ma'am.
also, Monica ma'am.
Yes.
Best wishes, Dr. Ashna ma'am, best wishes.
I
Yes.
need all,
And Dr. Prerna, Dr. Madan.
madam, I need all support for my dear Madan, for pay,
Yes.
and of course for myself. Please help me and please support me, because this is a
Sure, ma'am.
Yeah,
task.
definitely.
I need your blessings.
Definitely,
Sure,
AMOG
ma'am,
is with
sure.
you.
I am
And
always at service of MP. MP is my heart, but AMOGS is also my heart. If MP
yes.
is my right ventricle, AMOGS is my left ventricle.
Oh, thank you so much.
Maharashtra,
Okay.
Maharashtra has supported me like younger sister. So I need all support. Prerna, I'm doing now fantastic programs with Northeast and Bengal. I know how loving and how affectionate they are. And really need, I'm always there for all academic activities 24/7. I'm there to counsel, I'm there to be there.
We are coming to Indore, 7th of May.
Yes.
Yes, yes. Yeah, we will be meeting you very soon.
Everyone
And
in person.
a special thanks to Dr. Rekha Singhal, ma'am. She has given me cases, 3 cases I have added, and she has wonderfully made the cases for the panel. Yes. Thank you, Rekha, ma'am.
Rekha is our shining star.
Yeah, she has to shine. Okay.
Spark.
Thank you. Yes,
Thank
thank
you
you so much on behalf of AMOGS. Thank you, Corona Remedies, and thank you all the faculties who have joined today and made it a great show. Thank you so much.
Thank you so much.
Thank you,
you.
Madan sir.
Thank
Thank
you.
you,
Good night.
Good night.
Prerna madam, and all the respected panelists. Thank you
Yeah.
so much.
Yes. Thank you,
Thank you.
Harshvardhan from Corona Remedies. Thank you.
Thank you, sir. Thank you, Madan sir.
Yeah.
Thank you, all
Yeah.
esteemed faculty members. Looking forward to connect more with you.
Yes.
Thank you.
Okay.
Yes, sir.
Thank you.
Thank you. Thank you. Good night. Bye, Prerna.
Bye. Thank you, everyone. Thank you.
Bye, Dr.
Thank
Madhu.
you. Thank you and good night.
Good night.